Good morning, everyone. My name is Sullivan, and I am professor of pharmacy and public health at the University of Washington in Seattle. I'm very grateful to having been selected to deliver the 2024 Rokai Lecture Award. My students at the university nominated me, and for that, I'm very appreciative. By way of introduction, I trained in pharmacy at Oregon State University and then completed my master's degree in pharmaceutical economics at the University of Texas in Austin. And then I went on to complete my PhD in health economics and policy at the University of California, Berkeley. Since 1984, I've dedicated my career and my research to helping improve access to pharmaceuticals and to training and mentoring the next generation of pharmacists and pharmaceutical scientists. The Rokai Lectureship is an opportunity for the awardee to address a topic of interest to Rokai members and to the pharmacy profession writ large. Today, I would like to discuss a topic, scientific and health misinformation, that is a growing crisis, insidiously infecting the public's fundamental belief in science and in the value of healthcare. Misinformation poisons minds, and it stands in the way of our collective commitment to improving the health of our patients and of the communities that we serve. Importantly, I want to talk with you about how scientific and health misinformation is created, how it grows, how it infects minds, and specifically what you might be able to do to counter misinformation when faced with the opportunity to do so. Let's first start with an example. Consider these three commonly disseminated COVID-related scientific and medical controversies. Which of these three statements do you believe is true? A, B, C? Let's go through them. A, mRNA vaccines for COVID increase the risk of acquiring COVID in the first 2 weeks after immunization. B, ivermectin, which is an FDA-approved antiparasitic drug, is safe and effective at treating COVID symptoms and preventing hospitalization and death. And then C, the wearing of masks eliminates the risk of person-to-person COVID and respiratory viral transmission. Before revealing the answer, though, let's learn something about brain science. The human brain can be easily fooled. You all know this, of course, but let me give you an example of how easily fooled the brain is. 6 headlines, very similar to the 3 I'm showing you here, were shown to 1,500 randomly selected people as part of a brain science research study. 3 of the 6 headlines were false and 3 were factual. When they were asked, about 50% of the participants said that they could totally feel confident that they knew the right answer to all 6. Yet, when the data were collected and analyzed, only 4% correctly identified the 6 headlines as either false or factual. The reality is that the human brain is not the ultimate fact checker. So, why is having valid science and valid health information important? Well, first, science positively influences cultural and social aspects of society. It inspires curiosity, it encourages exploration, and it broadens our understanding of nearly everything. I'm sure several of these reasons motivated you all to choose the profession of pharmacy. The application of scientific knowledge helps satisfy many basic human needs and certainly improves living standards. Finding a cure for cancer or discovering a clean form of energy are just 2 excellent examples of ongoing science. Similarly, science is a key driver of economic growth and prosperity. Many scientific discoveries have been revolutionary, and they've contributed to our collective economic productivity and prosperity. Electricity, the combustion engine, penicillin. Where would we be without antibiotics, for example? The cell phone that you might be holding in your hand or sitting next to you, 3D printing, and most recently, CRISPR gene editing technology, just to name but a few. Each of these discoveries has, or it will, dramatically change our society, and it'll provide economic growth and increase human prosperity. Science also contributes to population-level education. More and better education of our citizens about the value of science enables informed debate, and it also enables better decision-making about the fair and the sustainable application of new technologies. Think about new medicines, for example, or new vaccines, all of which help address large problems to our society, such as climate change, hunger and food insecurity, global pandemics, and social inequality. We all, I believe, recognize that science, and importantly, the accurate communication of science, is important. We also recognize, I hope, that science has meaningful social benefits. However, not all believe that science is helpful or useful. Some actively wish to discredit scientific advances and the very scientists and health professionals that discover and then apply these important innovations. So how does health misinformation start? And then how does it spread? Well, as you might guess, it starts small, just one individual, and then it grows through social media amplification, pseudoscientific websites, and biased and uninformed reporting. Now, on the slide here, you see the Disinformation Dozen. These are 12 individuals from around the United States that produce 65% of all anti-vax information on social media platforms and websites. These individuals, they're well known to researchers, and they're well known to the social networks that host their content. They include anti-vaccine activists, alternative health entrepreneurs, and even physicians. And one of them on this list is running for president of the United States. Some of these people run multiple accounts across different platforms, and they often promote natural health or natural immunity, and some of them even sell their own supplements and books. In other words, they create a market for misinformation. How do they achieve such success? Well, they take advantage of one of the factors that really promotes misinformation, and that is the simple fallacy called do your own research. A study conducted by two University of Wisconsin and University of Michigan researchers suggested that the promotion of DYOR by online misinformation and conspiracy theorists, rather than relying on evidence-based information from credible scientists, may reflect this growing anti-expert attitude that's in the general public. It's not like all believers of DYOR reject doctors and medical expertise, although some do, but they believe their opinion can be equally valid if they, quote, do their own research. Well, look, many of you have done your own research in your school or work lives. It's part of our business, if you will. It's part of what we do. And you know the challenge of doing that, the effort that it takes, and then the critical thinking that's required to find the body of research, to appraise it in a critical fashion, and then to draw valid conclusions from that. Many misinformation and scientific conspiracy activists promote the DYOR philosophy. They actually encourage people to DYOR. And then they direct the unsuspecting public to their websites, where they have curated their own, often biased, research on a specific topic. The public sees that and then amplifies these sources of information using their own social networks. And from there, it grows. Let's return now to the three topics that I shared with you earlier, these scientific controversies. Can you spot the fake news? Well, let me start by telling you that I tricked you, because all three are in fact not factual. So let me take you through them one at a time. and show you how that information is created and spread. Well, let's start with the mRNA vaccine. Point of fact, mRNA vaccine platforms have been around for 20 years. We have been experimenting with mRNA platforms to try to create an effective HIV vaccine and have not yet been successful. When COVID entered, we happened to have the mRNA platform and applied this platform to try to create a COVID vaccine. And guess what? It worked. So the mRNA platform is not new. It's been around for a while. And now we have an evidence base for the efficacy and safety of the mRNA COVID vaccines, which is amongst the largest evidence base ever assembled for any medical intervention. There are literally hundreds of millions of individuals who have been exposed to these vaccines. And it is really clear now from the accumulated science of immunology and pharmacology that the vaccine and the vaccination process itself does not increase the risk of acquiring COVID. It does, however, take 7 to 10 days after the vaccination before full COVID immunity is achieved. Now, one of the sources of the misinformation that I showed you in that first untruth statement was a nurse who had been exposed to COVID just prior to being vaccinated, early during the availability of the COVID vaccines. The timing of her symptoms and the receipt of her vaccine were such that she attributed her COVID infection to the receipt of the vaccine. She believed, therefore, that the vaccine actually caused the infection, when in fact, she had been exposed to COVID prior to her vaccination. She confused causation with association, and she spread this information across multiple social media platforms. Of course, the anti-vaccine advocates, including many in the Disinformation 12, picked up on her posts and amplified them themselves with headlines like, "Health professionals confirm that COVID vaccines cause COVID." Now, number two, before we had effective antibodies and antivirals like Paxlovid, ivermectin was widely touted as safe and effective in the treatment for COVID symptoms. The role of ivermectin was, at the time, an important and unanswered scientific question. Imagine if we had a treatment available that was as inexpensive as ivermectin and we could make it available. We simply didn't know whether it worked or didn't work. And without any evidence, President Trump endorsed through speeches and many, many Twitter posts the use of ivermectin and the use of other unproven therapies. He used his celebrity and his position of power to drive a massive increase in the use of ivermectin and, sadly, also in the sale of chlorine, when he endorsed injecting chlorine as a way of killing the virus. We now know, though, going back to ivermectin here, that ivermectin is not effective at all. There was a study first published in February 2021, small one, in the Lancet. But since that time now, JAMA and the Cochrane collaboration have each published a body of science that confirms what we knew from that early study, that ivermectin is not effective. Even today, though, with the scientific question largely resolved, there remain people and organizations that still believe and spread misinformation about the effectiveness of ivermectin and other unproven therapies. Now, let's turn to the wearing of masks, whether mandatory or voluntary. This has been highly controversial, as I believe many of you know. Studies prior to the pandemic about wearing masks produced mixed statistical results on the effectiveness of masks against respiratory viruses. And this, of course, led to confusion that may have contributed to organizations such as the WHO and the CDC, which initially did not recommend that the general public wear masks during the pandemic. Well, of course, the misinformation crowd picked up on this confusion and advocated, sometimes very strongly, to not wear masks, and advocated and made statements that masks were not effective. Well, what do we know now? We know now with certainty that mask wearing does reduce the risk of viral transmission, but it does not completely eliminate the risk. It all depends on the mask, the fit of the mask, how many people are in the room or the space, and how many of them are also wearing masks. See, even scientists and the public can confuse risk reduction, which is exactly what masks do. They dramatically reduce the risk, but they don't eliminate the risk. And this is an important distinction that the general public struggles with. So how does the public recognize misinformation, right? Let's start there. So it's important to recognize that humans are prone, all of us are prone to confirmation bias, which is the tendency of people to favor information that confirms or strengthens our pre-existing beliefs or values. This bias is difficult to dislodge once it's been affirmed. Misinformation messages stick. They stick especially when they confirm a preconceived bias that people already have. Number two, the scientific and health literacy of the general public is low, but there are some surprising bits of information about public literacy, and let me tell you about them. The public generally doesn't understand concepts that I've talked about so far today, like risk, probability, odds, causation. Yet this is how we, in the medical and scientific community, we speak to each other. I mean, you heard me using some of these terms, writing some of these terms here as I'm talking to you today. But it's also how we in the scientific community speak to the public. And the public generally doesn't understand these terms. In 2019, before the pandemic, the Pew Research Center released some important work on the overall scientific literacy of the US population. And here's what they said. First, Americans with more education score higher on scientific literacy. Seems to make sense, yeah? Second, that Republicans and Democrats hold similar levels of scientific knowledge. In other words, your political affiliation doesn't matter. And third, that about 2/3 of the American public understands the scientific concept that science is iterative, meaning that replication and iteration of research is important to ultimately arrive at a conclusion, at a truth. So to summarize this in short, science knowledge is directly tied to education and not to political affiliation, not to gender, not to race at all. It's tied to education level. So how can we recognize misinformation? First, fact checking. Well, with the internet, you'd think, wow, I've got an easy tool right at my hands here to fact check information. But frankly, with the volume and variability of information that's available, fact checking is growing more and more challenging. And AI will make this worse. But there is one source, and I put the website up here on the slide for you, and that's factcheck.org. It's a public service website from the Annenberg Center at the University of Pennsylvania, and I encourage you to check it out after this presentation, or I guess after the meeting. Second, evaluating the credibility of the sources. So see what others say about the people, the organization, the publisher of the information. Check the other stories and headlines on the website or at the source of the information to see if it all seems credible. Do all the stories lead back to the same common source? And if so, that's a reason to be suspicious. Third, peer review and confirmation. the foundation of science. So important, and so important to recognize that the public generally doesn't understand the value of peer review and confirmation. In fact, there's the fallacy that a single study is definitive. I saw it, I saw the conclusion, and therefore it's confirming my bias, and therefore I believe it, post it, amplify it, right? Research takes time. Science requires confirmation. And finally, the importance of critical thinking. Pulitzer Prize-winning author and distinguished astronomer Carl Sagan argues that scientific thinking is critical, not only to the pursuit of truth, but to the very well-being of our democratic institutions. He said, and I quote, "How can we make intelligent decisions about our increasingly technology-driven lives if we don't understand the difference between the myths of pseudoscience and the testable hypotheses of real science?" So what I'd like to do now is finish with a comment on the future of truth, and then some suggestions for how to address and combat scientific and health misinformation. On the future of truth, I'm worried. I'm worried about the looming dangers of deepfakes and other online deceptions and impersonations. This is real, it's happening now, and it's scary. Deepfakes use artificial intelligence and deep learning methods to create highly realistic but fake content, including videos. Do a quick Google search for deepfakes. Check out some of the videos that are available online. You'd be surprised if you haven't already. Often these videos look highly convincing, and to the unsuspecting public and the uneducated public, they can be convincing. ChatGPT and other AI tools are making deepfakes more prevalent and realistic, and they will make it harder in the future to tell the truth from fiction. So, how will we ultimately address this? Research shows that people become more resistant to persuasion when they perceive an intent is being made to manipulate them. And then, if they can recognize their own vulnerability to being persuaded. The suggestions that I'm going to share with you now may help people make more informed and therefore less prone to being manipulated. So one, provide facts. And these facts can inoculate people against future specific falsehoods or lies. Let me give you an example. So tell your patients ahead of time, just as either before or as you're giving them their vaccine, whether it's flu, RSV, COVID, pneumococcal, doesn't matter. Tell them that they very well might experience a transient sore arm. They might have mild fever. And in fact, that's not a side effect of the vaccine. It is, in fact, an indication that the vaccine is working. It's eliciting a very successful and powerful immune response. But those patients who don't experience those symptoms shouldn't worry either. The simple approach of providing an explanation ahead of time, ahead of an exposure to something like a vaccine, will inoculate against a persuasive message from the internet that suggests that these vaccines cause a disease. Myths and truths are also often presented by pseudo-experts who claim to have specific degrees or training and experience in a specific scientific or health area. These, quote, experts claim to know the truth, and more importantly, they will tell you that there are nefarious people or groups working in secret to try to dupe you from learning the truth. Certainly people dislike being manipulated, especially those who pride themselves on being independent thinkers. But the overt manipulation is harder to spot when the myths and the untruths are perpetuated by real, credentialed scientists and health professionals. So the role of scientists and health professionals to communicate clearly, using language that can be understood by the general public, is so very important. I return to the example of the nurse who contracted COVID shortly after receiving her vaccine. This circumstance likely occurred not just once with her, but many times across the US during the various waves of COVID infection. All it took was for a few of these individuals to read social media posts from others with a similar experience to, quote, confirm the truth. And then it spread. There'll be new challenges and scientific controversies beyond our current COVID pandemic. The evidence base for many scientific and medical questions will likely never be fully settled because we learn new things every day. We learn about the biology of humans. We learn more about pharmacology and mechanisms of action. And there are many, many studies ongoing that will help us better understand benefits and safety of the treatments we currently use with our patients and that are coming in the near future. Our role as pharmacists is not to just be the trusted advisor to the public, but to be an unbiased producer, consumer, and ultimately communicator of scientific and medical truths. We should strive to resist the temptation, though, to succumb to misinformation fatigue and always stay vigilant. So to conclude, the real consequence, the true consequence of the growing prevalence of misinformation is that it erodes public trust and it can influence public policy decisions. But in some cases, misinformation can be deadly, and it was so during the pandemic. A research study reported in JAMA suggested that about a third of the more than 1.1 million reported COVID deaths in the United States as of January 1st, 2023, were considered preventable if scientific and medical recommendations such as vaccinations, masking, and physical distancing had been followed. And then this study I'm showing you here, which is very recently reported, and really makes me ask the question, why is it that after all we know, all that we have available to us to prevent and treat COVID, are we still experiencing on average 1,500 COVID-related deaths per week? With all of this, I hope you appreciate that we are not defenseless against the forces of scientific misinformation, and that we have a real opportunity to combat deception for the good of our patients and for the communities that we serve. Thank you very much for your attention, and I wish you all a successful ROCI meeting. Thank you.